Today, we are discussing something that is often overlooked in most public conversation when it comes to diabetes, and that is metabolic syndrome. And for me, I dubbed it as the silent cluster before diabetes, and we're going to look at why the risk starts before the blood sugar rises. I'm your host, Charis Yonyoni. I'm the founder of the Diabetic Desk. So most people think, even you watching me, um, diabetes often starts when your blood sugar rises, but in reality, the metabolic changes begins years earlier. That's why it takes 5 to 10 years for you to be diagnosed with diabetes. And metabolic syndrome is the silent cluster of risk factors that often precedes type 2 diabetes, which often occurs in adults. And I feel like if we understand this stage, we can intervene earlier, reduce risk, and prevent progression. This is both for the healthcare professionals and also for the layman who is watching me and you want to know about diabetes, or you have someone living with diabetes, or your caregiver. This conversation is about recognizing the early metabolic imbalance before we progress to type 2 diabetes. So we're going to look at why this topic matters. So globally, I don't want to state the statistics. We all know we are currently at 589 million people living with diabetes, and it continues to rise. Projection up to 800 million people with diabetes in the year 2050. That is quite a huge number, and I feel like despite better medication, advancement in technology, and also improved awareness, like I'm doing in the diabetic desk. Uh, this is a report that was released late last year by IDF 2025. I don't know if 2026 is out yet. I doubt. Millions of people are living with diabetes, and many more have pre-diabetes. That is the state between being termed as diabetes, like your sugars are high, but they're not high enough for you to be told you have diabetes. And most of us, like last year was 72% are unaware they have diabetes, so they are undiagnosed. So you can imagine 72 of us don't know we have diabetes. That is quite alarming. But even more concerning is that many of those individuals, even us, um, we have metabolic syndrome, which often goes unnoticed, and this significantly increases your risk for cardiovascular diseases. And I feel like these syndromes are modifiable in nature. Like I talked about the non-modifiable factors and the modifiable factors. Well, we already looked at those risk factors, but most of those metabolic classes risk factors are modifiable. This means we can change them. Yeah. So that is the best news. That when you watch this session and you feel inspired to change, reach me out. We're going to look at more of this as I leave my contact at the end of the session. So diabetes rarely begins with high blood sugar. It begins with metabolic imbalance. That is the quote I had for the whole session. So please stay tuned. I hope you'll enjoy this episode and be able to learn something from it. So we're going to define what metabolic syndrome is. Of course, some of you have come across it, the curious souls, you've read more on it. So leave it in the comment section if you've come across metabolic syndrome. Are you a healthcare professional? Are you someone who's curious? Let me know. But metabolic syndrome is a cluster of interconnected risk factors that occur together and increases the risk of getting or having type 2 diabetes, having cardiovascular diseases, or heart diseases. There are so many of them. I think I'll record another session where we just talk about cardiovascular diseases and stroke being among them. So the International Diabetes Federation defines it as a constellation of risk factors that reflects underlying insulin resistance and central obesity. So that is according to the IDF, and that is my trusted partner. I read most of articles and any resource they put out there because I'm very curious and very passionate about diabetes. So for me, I always want you to think of it as a warning system. Like it's not yet a diagnosis, it's a warning system. Like when there's a tornado coming or a tsunami, there's always the warning system put in place to be able to alert people so that proper measures can be taken. Like it's a signal. So I want us to understand what a metabolic syndrome is, and that is what I classified this as. So there are five diagnostic components when it comes to metabolic syndrome, and mostly when you go get checked, they will look at the five of them. If you have three or more of these, then you have metabolic imbalance. So this includes central obesity, that is increased waist circumference, elevated fasting blood glucose, elevated triglycerides, low LDL, cholesterol. That means you have high low density lipoproteins. We're going to look more at that in the later slide, and also elevated blood pressure. So each of these alone carries a risk factors, and together, if you have central obesity, if you have elevated fasting blood sugars, you have elevated triglycerides, you have elevated LDL, which means you have low HDL. It means you're at higher risk of developing insulin resistant prediabetes and also diabetes. So we're going to divide each one of those five, and we're going to look at them so that you can be able to understand. I'll try my best not to make this episode long, but I can't, because these are things that we should be aware as you continue looking into your lifestyle, changing your habits, and all that. So we're going to start with central obesity. So you can see on the screen, we have the beer belly. I demystify people who embrace beer bellies. Beer bellies are not attractive, and for me, beer bellies are just something that is telling us metabolically you're not okay. So central obesity is excess fat around abdominal organ. That's why it's called the beer belly. So the visceral fats, the fats that I usually write so much on the articles portion of the diabetic desk. This is the fats that line our organs. When it's too much, you start having a belly fat, or you have beer belly. So you can see on the screen we have subcutaneous fats, and we have the visceral fats, and we have the abdominal mass. So when you have a lot of visceral fat, it's I think I read from a paper, it's metabolic active than the subcutaneous fat. So it releases inflammatory mediators, which most of the time are strongly linked to insulin resistance. That's why when you have central obesity, we have to check, because most of the time you're starting to develop insulin resistance. So I forgot to really input the waist circumference measurement, but I think I will put it as I edit this video so that you can be able to take a tape measure and measure yourself. You know, these are things that you can do in the house. So that's why I wanted you to understand the role of central obesity when it comes to metabolic imbalance. So we're going to look at elevated fasting sugars. So I know you've had fasting glucose sugars, yeah. So fasting glucose is measured after 8 to 10 hours without food. Guys, this is when Bad decides to also make a cameo on this video, so I hope my voice is audible enough. So this is taken especially in the morning when you've not had anything to eat. So when you have high, there's an indication of impaired glucose regulation, which suggests early insulin resistance. It's not a must you have diabetes for you to be taking the fasting. You can just go and know where you are. And it's often precedes the diabetes diagnosis. This one and HbA1c, um, they're used to. So I forgot to also leave the pre-diabetic ranges, but here it is. This is just the fasting sugar levels. So when you have below 5.6 millimoles, you have no diabetes. When it's 5 to 6.9, you are pre-diabetes. So when it's above 7, when it's taken 2 or 3 times or 4, or you're told to go rest and then you come back, it's still high, then you're told you have diabetes. So I hope you've understood the elevated fasting. This is when you've not had anything but your sugars are still high. So we're going to look at triglycerides and HDL. These are triglyceride is a type of fat found around our body. So HDL, these are the good cholesterol that helps remove excess fat from your cells to be broken down. You know, the LDL, they take the fats to deposit. HDL, they remove excess fat. So when there's high triglyceride level and low HDL, which means you have high low density lipoproteins, it reflects insulin resistance. And lipid abnormalities are part of metabolic dysfunction. So when you go and you get your test done, this is just a chart I came across when I was reading online. So the ideal, these are the ideal. So when it's too high in men, in women, this is how it is. So we aim to improve the HDL and reduce the LDL. So we leave the synonyms and their definition on the screen so that you can be able to understand. When I say HDL and when I say LDL, you're able to understand. I'm trying to make this session not as technical as it is, because when I go deep, you guys will lose each other. Hypertension means persistently elevated blood pressure. So looking at me, you're watching me. Have you ever checked your blood pressure? If no, stop, go check, and then you come and tell me what you think, or just write it in your notebook. For me, I had started this habit where monthly I go check my blood pressure for personal reason. So insulin resistance affects vascular function. That is the endothelial, which is the inner lining of the blood vessels. So it also influences the sodium retention and the sympathetic nervous system activity. So this results in elevated blood pressure, which further increases your cardiovascular risk. So individuals with metabolic syndrome have approximately double the risk of any cardiovascular event. So you have to know your blood pressure. Um, Please do. These are things we shouldn't be begging you guys to do, but just do it for your own health. So we want to look at the root driver, which is insulin resistance. Because I know I talk about insulin resistance because for me, I want to create awareness on the preventative segment before we get to the curative. So at the center of this metabolic syndrome lies insulin resistance. Insulin resistance occurs when cells, especially in the muscles and liver cells, do not respond effectively to insulin. So our pancreas, as you see on the screen, compensates by producing more insulin, and it creates a state of hyperinsulinemia. This means the insulin levels are above the normal, so they're increased to suppress the glucose into the body tissues, glucose, and also any glucose that is roaming around. So hyperinsulinemia affects the fat storage, lipid metabolism, like we've seen the triglyceride and the HDL, blood pressure regulation, and also the inflammatory pathways. So metabolically, on metabolic syndrome is essential in the systematic expression of insulin resistance. So you have to know from the screen when there's high blood glucose because there's no control or is not responding to the insulin. The pancreas does its job by releasing insulin. So you create a state of having a high insulin level in your body so that it can reduce the number of glucose in your blood. So you'll find that it will affect all the drivers that we have talked about in the previous slides. So why metabolic syndrome is dangerous? Because it increases the risk of type 2 diabetes. We already know what that is. Cardiovascular diseases, non-alcoholic fatty liver disease, chronic inflammation. I think I'll also do a session where we talk about inflammation, and so that you can be able to understand when I say inflammation. We also look at drivers of inflammation. I think that is should we do next, or we do insulin resistance. Let me see how it goes. So in other words, the whole is more dangerous than the part. So all we've talked about the fuel, the metabolic imbalance, which can increase the risk of NCDs. So why does it often goes undetected? Because metabolic syndrome is silent. There is no pain, no dramatic scene. That's why you stay 5 years and with diabetes and you don't know. No early alarm bells, like when you fall and you feel pain, you will not feel pain. So most of us, we often focus on weight alone, we skip the routine checks. Like, I encourage you to do it monthly. We skip it. We don't measure our waist circumference. We don't do our lipid panels. We don't check our blood pressure. I know in most chemists there's blood pressure machines that you can use, and I feel like that's why this platform is important to me, because I can be able to educate people on how to do this, and also push myself to do this, because the risk factors accumulate silent. So most of you will ask, is it reversible? Of course, especially in the early stages. That's why it was a warning system. When there's a warning system in place, you'll be able to do something about it. So there's a program, the diabetic prevention program showed that lifestyle modification reduces diabetes incidence by 58%, especially in high risk individuals, those people with non-modifiable factors, family, ethnicity, age, and all that. So evidence supports 5 to 10% weight reduction, regular resistant training. I think I will interview a health weight or a fitness trainer so that we can know these exercises. Moderate aerobic activity, that is 150 minutes of moderate activity weekly as per WHO. Reduction in visceral fats, improved sleep, and sleep is very, very important. I feel like all this will go in hand in reducing the risk factors for the metabolic dysfunction. So we're going to look at the role of daily patterns, because metabolic syndromes are shaped by the patterns. I hope you're able to see it's about to rain, and I'm trying my best to finish before it gets too dark. So, long sitting hours, poor sleep quality, chronic stress, low muscle mass, ultra processed food environment. These factors influence our insulin sensitivity daily. So the more you sit without exercising, the more you have sleep poor quality, chronic stress coupled up with ultra processed diet, you're reducing your insulin sensitivity and increasing your insulin resistance. That is where prevention must move beyond food alone. You've noticed I've not even touched on food. I've touched on all those other drivers that affect our metabolic syndrome. So, what does this mean for prevention? So, we must begin before glucose rises dramatically so that you're told you have diabetes. We have to screen for waist circumference, check our lipid level, assess our blood sugar. Blood sugar, let alone kama hutaki blood sugar, just assess your blood pressure, monitor fasting glucose, and then build muscles through strength training. So for me, metabolic syndrome is an early intervention window. Like, we focus on the lifestyle pattern before a crisis emerges. So as I wind up the episode, I just want to tell you guys, metabolic syndrome is not a life sentence. For me, it's a warning system. It's your body telling you, know what, sit down and look at me. I am talking to you. There's a problem and I want you to tackle it and look at it so that you can be able to change. So by the time diabetes is diagnosed, the metabolic story has often been unfolding for years, but we just choose to not focus on it or ignore. We are too busy to notice. So if we recognize the cluster early, we can change the trajectory of our risk factors for developing this NCD. So better understanding leads to better prevention. So let's stay connected, stay informed. Contact me through this number, reach me on this email address. Let's talk more about diabetes. If you want me to be a speaker, you want me to train you guys on diabetes, I'm open, and I'm working on big things when it comes to the diabetic desk this first quarter. And I feel like this pre-recorded webinar doing a whole lot good for me. Please subscribe to this YouTube channel. It's just a new baby. I have 3 or 4 subscribers. Please share, let people know about this platform where I talk about diabetes and creating awareness around diabetes as a nutritionist and a diabetic researcher. So see each other in the next episode. Bye.